Hello, hi guys. Can you all hear me? Hi. So, okay, let me just go to the. Actually, it takes me a little while. Yes, I'm audible. Excellent, excellent. I can see the questions coming in now, the comments coming in. Okay, guys, can you see the screen that I'm sharing? Just answer me yes or no if you can see my screen or not. Anyone? Can you see the screen that I'm sharing? Very small. You say very small. How do I go for the screen share option here? Like, how do I show you my screen? Is the screen big now? Can you see the screen becoming big? Just let me know, yes or no. Yes? Okay, great. So, I think what I'll do is I'll also go on my phone and so that I can keep seeing your comments while I'm explaining. Otherwise, it would be very weird. Okay, I'll be starting with the explanation. Okay. Okay, fine. So I can keep on seeing the comments on my phone if you have any doubts or questions. So I'll come to know what you people are writing. And I'll start solving the question now. So, yeah, this is better. Excellent. Excellent. So I'm taking a paper of a candidate. So for my ADC mock test 2, some 103 people had solved. And let's go to one of the candidates' solved paper. So I hope you can see the first question. Let me know if you can see the first question. That is a 48-year-old patient on warfarin presents with a tender root canal filled upper first molar. The pain is severe and intermittent, and it is more pronounced on biting. So, when you're reading this question, as you're reading the question, your brain should start thinking, the pain is severe and intermittent, and it is more pronounced on biting. Now, when you see more pain is there on biting, means something has to do with the PDL, okay? He had received a prosthetic heart valve 5 months ago, so he's having a cardiac condition. So somewhere in the subconscious mind of yours, this question should come, that maybe an antibiotic prophylaxis question is gonna come. The tooth is tender on percussion. Now this sentence is so important. The tooth is tender on percussion, because why? It's giving you the clue that somebody has already examined and the percussion test has been already conducted. Meaning, if suppose a question like comes, which is the next test that you would perform and percussion is an option, you should not be choosing that, because it's already mentioned that the tooth is tender on percussion. So you see, I've not even finished my question reading, and I'm already having the arrows and the direction in which the questions can be asked. I'm kind of already prepared as to what is going to come for me. The radiological examination showed that the canal is overfilled, but there is no periapical radiolucency. Alright. So now let's go and see. You can see the radiograph. The radiograph in the exam also may not 100% match the question. So you should always have faith and trust what is written rather than seeing a lot of radiograph. If you doubt the radiograph is not matching the question, then you focus on the question, not the radiograph. Understood? I hope everybody is fine with this and I'm audible and you can see everything clearly, correct? So, once again, okay, only 6 comments so far. So, yes, okay, great, excellent. First question of this sub question, scenario based question. Based upon the radiograph and the symptoms, the most likely diagnosis for the condition of the first molar is. What has the question mentioned so far? It's RCT tweeted, so there is no pulp. Okay. There is no radiolucency, so you cannot go with periapical granuloma, correct? Because granuloma would be radiolucent. Fracture root is kind of an option which you can consider. Apical scar is again something which you will be seeing on the radiograph, but there is nothing on the radiograph. And the question also mentions it. Apical cyst is a big thing. Cyst has a definite radiolucency surrounded by radio opacity. So I'm ruling out cyst, I'm ruling out scar. Fractured root I am considering a bit, but I'm not so sure about it. Periapical granula I'm ruling out. So I'm left with two options to consider now. Fractured root or periapical periodontitis. Now for the fractured root, some other investigation has to be done or something more the question should have said. Because it's not said, then I'll go with my most easier diagnosis, that is periapical periodontitis, because there is tenderness on percussion, the question has mentioned, and no other definitive thing which mentions there is a fractured root. Understood? This is how you analyze the question. So you see, even if you did not know the answer to this question, by eliminating certain options and focusing on just the two options, you could logically conclude that this is your right answer. Now this candidate has marked this answer as right, that's why it's showing as a green tick there. Okay. But still I have mentioned the feedback that tenderness to biting and percussion indicates inflammation of the PDL and the overfilled canal provide a likely cause. Although no radiolucency shown on the radiograph, but it is not required for diagnosis in presence of a typical symptom. Understood? Let's go to the second question. I hope this is clear and you understood this question. Say something, guys, so that I know you are with me. Anybody saying something? I think I'll have to go and see the comments again because can't see from here. Okay, yes, all right, all right, all right. Okay, let's go back to the second sub question then. The patient records showed that he is not a regular attendee due to living in a regional area. Now, see, this is a very important sentence. Why? Not living in a regional area, meaning he's living in some remote area, which means that he cannot have regular access to the dentist, which means that he cannot come for more than one appointment, which means that you have to do something definitive in one appointment. Now, what is definitive? Definitive can either be extraction or it can be just a simple filling. It cannot be a root canal, because root canal, even though if you can finish in one visit, you will have to call the patient for the crown and subsequently fixing of it. Understanding? So when you see not a regular attendee, which means he is anyways not going to come back, and he also is living in a regional area, which again means you have to finish something in the same session. Even before you go to the options, you know the answer has to be extraction or a filling. And in this scenario, since it's already root canal treated, half of the restoration is not there. The only option that you have is extraction. But let's read the other options. Restoration of the upper molar, it's not possible in this scenario because it's unrestorable tooth, and plus he's having pain. You will not achieve anything by restoring this tooth. Root canal retreatment, not possible in this scenario because the patient is staying far away. Antibiotics is not going to cure his pain. Root canal retreatment and restore with post and core is a very good option but doesn't apply in this scenario. What applies in this scenario? Extraction. Got it? So this is how you analyze the second question. Look at the feedback. So this candidate marked this question also correct. That's why she has a green tick over that. The patient is risk of infective endocarditis. They have heart valve associated risk of infective endocarditis. We have to remove any source of infection and it can be done by exo or another root canal filling. But like I said, they want a definitive treatment. Plus, we happen to have a cardiac condition, so the option just becomes an extraction option. Now, if they would have said, example, that this patient is living in city and is a regular attendee, meaning he is very diligently going and visiting the clinic, then what would you do? You would still go for extraction, because in cardiac patients you never want to leave a focus of infection inside the mouth. Re-root canal treatment is an option, but if an extraction option is given, then extraction gets more priority. Now, if these options did not mention extraction, then I would choose re-root canal treatment and restore with post and core. Understood? So the same question, if I just change the wordings of the question and I remove one option, my answer differs. So there is no point you mugging up. You have to understand the concept and read the question very properly. Are you getting my point? Is it clear? Can I move to the next question? Give me your feedback, guys. Is this okay? Should I move on to the next? Any questions? Any doubts? Okay, let's proceed then. Next question, the third sub question of the same scenario. Now, while you are reading the third sub question, don't forget you are still on the basic mainframe of the question, which is the patient is having pain, he is having heart valve problem, and he stays in a remote area. Okay. Now, the patient had a prosthetic heart valve replacement done 5 months ago. Is he at a risk of infective endocarditis? For this, you need to know your basics, guys. Any heart valve patient for the first 6 months needs antibiotic prophylaxis, which means he is at a risk of infective endocarditis, and that's why you have to give him an antibiotic prophylaxis. Whenever a valve replacement is there, it's a very risky operation, and valves are the place where endocarditis starts. So yes, he definitely is at a risk because they have specifically mentioned 5 months ago. So in the options, answer no, maybe is rejected. Now CD option, okay. Yes, antibiotic prophylaxis is needed pre-operatively. Yes, it is needed post-operatively. And the last option is both C and D. Now this candidate marked this answer wrong. So when you mark an answer wrong in my mock test, you'll get a red cross. And then you'll get the feedback which is mentioned below, which is it's needed only pre-operatively. See, there was a phase in medicine, in dentistry, where we used to also prescribe antibiotics post-operatively. But since the guidelines have changed, you don't need antibiotics post-operatively. So only pre-operatively becomes the right answer. Okay, remember this. You will 101% get a question on antibiotic prophylaxis in your exam. Please mug up the therapeutic guideline antibiotic prophylaxis table. Also mug up the therapeutic antibiotic guidelines table. There's a difference in the cardiac antibiotic prophylaxis and therapeutic antibiotic prophylaxis. Understood? Next question. The next question, also this candidate marked it wrong, hence there is a red cross. The primary consideration during treatment of this patient, which is the most important word in this question, this patient. This patient now changes the entire scenario. If I had just written the primary consideration during requirement of a patient, it's a different answer. You know, this patient means this scenario. So, what are the options? Restore aesthetic, stop the pain, remove any source of infection. All correct answer, option 7. Forget the correct answer in option 7. Focus only till D. So, see, the question did mention that the patient is in pain. Okay. Now, if the question would have just stopped at that the patient is in pain and would not have mentioned about the cardiac condition, then my answer would have been stop the pain. You understand? But what the question says, this patient means what is this patient? This is the patient with pain and cardiac condition. Now, when I am having a cardiac condition, I am more bothered about the overall life of the patient than his tooth. Now, the priority is no longer the tooth, is its overall health. So, my answer for this question becomes remove any source of infection. You understand? So stop the pain is not a wrong option, but it is wrong option for this patient. If this patient did not have cardiac problem, then it becomes the right answer. So again, you cannot mug up. If you knew the concept, then you can solve any ADC question. So this is what I do basically in my course. I never ask any person to mug up anything. I just keep on giving them questions after questions in my mock test, and there are such varieties of question that you have to think. You cannot mug up an answer because this is what it is. Now the same question can come in ADC and they'll change some words. And you'll be like, Arey, I have to read this question. No, read it properly. There'll be some words which have been changed, which will change your answer, but the options remain the same. Understood? Getting, are your brain windows opening up? Answer me, guys. Feel a little freshness in your brain? Learning a new dimension? Yes or no? I'm waiting for your comments. Should I proceed for the next question? Valves get endothelialized after 6 months. Kind of, yeah. What if it is said that the operation was done before 8 months or 12 months? Then antibiotics required? Antibiotic prophylaxis? No, it's not required then because it's just 6 months. But then again, if they are mentioning 8 or 12 months now, they will be giving some other condition along with it, which they might just also give an option like refer to a specialist or let the specialist decide like this. Like they'll be very specific. Understood? So, okay, let's proceed. Now we go on to, the fifth question of the same sub question. You see, I'm still stuck on the first sub question. I'm a scenario based question. This is how it will happen in the exam. You'll be like, oh my god, this question is not ending only. It happens, but it's fine. What is the fifth sub question? Post-operative extraction instructions are necessary regarding the risk of endocarditis. Which statement is wrong? Again, this candidate marked this answer as wrong. Now you see, if you would have seen all these questions, you know your dentistry, correct? None of the questions were like you did not know the answer. Probably, but still, if you were in this candidate's position, you might have made the same mistake what she did. It's not like you did not know any answer. You did, but you did not know how to approach the question or how to put which option as the priority in the hierarchy. You understanding what I'm saying? So all this we have studied in our normal PDS, and yet we are marking the answers wrong because the approach and the attitude towards the questions need to change. So no matter how much information and the books you'll read, when it comes to solving, you have to think in a different way, and that is why the importance of mock test. I'm again and again insisting on mock test because I know this is the key. This is the only golden key to solve ADC. Understood? Okay, let's focus on this question. Which statement is wrong? Okay, now focus on which is wrong, meaning all the other statements will be right. Okay, so this is how you correlate, because sometimes you get exhausted while reading the question and you instead choose the answer which is right. So again, which statement is wrong? So first, alert for signs and symptoms of endocarditis. That's a correct statement. You should always be alert for the signs and symptoms for the endocarditis. Second is the symptoms may be of acute onset and progress rapidly or persist for weeks or months before the cardiac sign develops. Always, what have we read? What is Endocarditis, it's always subacute. SABE, that is what we remember, right? Subacute bacterial endocarditis caused by Streptococcus viridans. So they have mentioned everything except the sub word, and that becomes the answer. See, just eliminating that small three-letter word sub, but you don't think of it. You maybe like reading in a very fast way, you'll skip the sub word and may think, okay, this is the right option, which is what this candidate did, and she marked it wrong. Now, endocarditis caused by oral streptococci is usually of acute type. That is false. It's always a subacute type. Just now I explained everything. Patients with endocarditis of prosthetic valves progress to heart failure more rapidly. That is true. If the valves only fail, the heart failure is going to happen. So, what is the right answer here? Subacute bacterial endocarditis caused by oral streptococci viridans. So you see, the B option confused you so much that you chose that instead of the C option, which was the correct option for the question, meaning that statement was wrong. You see, it gets confusing. I'm so sure a lot of you would be confused with this question, but it's not confusing. You have to think very rationally. And just the elimination of that word sub, S-U-B, you know, that made your answer. So this is how alert you have to be in the exam. So there's the feedback. Endocarditis caused by oral streptococci is usually of the subacute type. So imagine you get this question in your exam and you think you have marked everything right, and yet when you see your score, you'll be like, oh my god, out of the 5 questions I've marked only 2 correct, the 3 were wrong. And that's how you end up not passing the ADC exam. Simple question, but it's tricky, right? Every question is tricky like this in ADC, which gets very mentally exhaustive when you're giving the exam. So I'm moving on to the next sub question, scenario based question rather. Are you guys understanding? Feeling little tensed now as to how can simple questions be tricky like this? Yes or no? If they mention refer a medical practitioner, yeah, then that should be the right option. If they mention that. Shall I proceed? You guys there? Yes. Okay, let's go ahead. Second question. A 23-year-old male presents to your clinic complaining of a discoloration of his teeth. Discoloration, meaning a lot of things can happen, internal or external. History reveals that the patient was born and grown up in an area that had excess minerals. The question is giving you a clue. In its water supply, in water, what can we access? Fluoride. That should be your answer. The first thing that should pop up in your mind. The medical history is not relevant. He is a casual smoker with good oral hygiene. Discoloration of teeth. So before going to the next line, the things that should pop up in your head is fluoride and tetracyclines. Okay. Now, because you see how smart the question is, they are giving you the answer. They said the medical history is not relevant, which means what? He has not taken any medicine. So they only ruled out these 2 options, fluoride and tetracyclines. They ruled out tetracycline because they said the medical history is not relevant. You understand the importance of this line now? He is a casual smoker with good oral hygiene. Casual smoker means, what are they trying to tell you now? That the stains, the discoloration of teeth can also be because of stains. But again, we rule out that because what does the question say? He had excess minerals in its water supply. So just by reading the question, you have ruled out 2 options. Are you getting my point? Don't take any word of ADC question as wasted. They have not written anything just like that. Everything has a meaning, directly or indirectly or passively. You understanding what I'm saying? So what is the most likely diagnosis? See, the first option, what it is, tetracycline stains. Even before I went to the options, I already discussed it. Dentinogenesis imperfecta is a very good question, okay? But in this scenario, it does not go because they have mentioned excess minerals in the water. Tobacco stains, why they have mentioned this? Because they have mentioned he's a casual smoker, okay? Caries. If here anybody will get stuck, it has to be between fluorides and dentinogenesis imperfecta. But dentinogenesis imperfecta, the enamel will be very, very chipped off. In this scenario, it is not. So the answer becomes fluorosis. Even if somebody did not know the answer, though just by reading the first question itself, fluorosis should hit your mind. And here's a long feedback. I leave it to you guys to read the feedback. All those people who have solved the questions and I've given you the feedback, you'll have this everything. Now you see, when I'm sharing for all those enrolled candidates with me in the mock test, the advantage is that they have in detailed feedbacks and they have the access to solve these mock tests again and again so that they know what mistakes they have done. You understand? Now, what is the first choice of treatment in this case? First choice. Now, here the key word is they have not asked what is the choice of the treatment. First choice. The words like first, initial, best, only, except. This changes the entire answer of your question. So, the first choice. First choice always has to be the most non-invasive, the least invasive, the most conservative. Walking bleach is done in non-vital teeth. These teeth are vital. They have not mentioned root canal is done. Composite restoration becomes an invasive treatment. It's not a wrong option. It's a right option. But in my answers of choice, in my hierarchy, the composite restoration would not appear as the first option. Full crown coverage is also a correct option, but again, it's an invasive option. In-office bleaching is the least invasive of all the options. Hence, I'm going to go with that. See, many questions now, it would be like the options would be like a sandwich, you know. It's like, what do you require in a sandwich? Options will be like bread, cucumber, tomato, onions. You require everything. All the options can be correct. But what is the most important thing that you will require? So you'll opt for bread because without bread the sandwich cannot be made. So similarly, what is the first choice of treatment? It will be the least invasive one, and that is the in-office bleaching. Though full crown coverage and composite restoration are also correct. Understood? Is this helpful, guys? Are the tips helpful to you all? Give me some feedback. Write something. Or am I just talking? Is this helpful? Should I continue? It's already 35 minutes. Yes, no, something. I can't see any comments. Should I proceed? Did you guys doze off? Okay, yes, I'll proceed then. Alright. What is the... Okay, now this is a very interesting question. What is the choice of in-office bleaching solution? By the way, this was an exactly my exam question of March 2022. So, I'm a pediatric dentist now. I'm not doing any more bleaching of teeth, correct? So, initially when I saw the options, even I got confused because I was like, Arey, carbamide peroxide, hydrogen peroxide, sodium perborate, everything is used. Then what gave the answer away? In office bleaching solution. Inside the office, you will always use a higher concentration. See, 5% sodium hypochlorite is a correct option. You know, when do you use this? Exactly when you have fluorosis or amelogenesis imperfecta. You may not have used 5% sodium hypochlorite. I'll tell you how to use it. It's actually very nice and it works. You isolate the teeth with a rubber dam. You take sodium hypochlorite in a dampened dish and you dip the cotton in it and you rub each tooth surface for 20 seconds and then you repeat. You etch the tooth and you rub it with sodium hypochlorite. It actually lightens the teeth. You know that? So that is a correct option, but not for this question because this is an office bleaching solution they are talking. Sodium hypochlorite does not exactly bleach, but it does lightens the tooth surface. Sodium perborate is a very good option, but for what? It's for walking bleach. Understood? So again, this is a correct option, but not the correct option for this question. Now, again, if you read the question, what is the choice of an office bleaching solution? Does this question has to do anything with the scenario based question? Nothing. It's just a basic dental question. Because here they have not mentioned this patient or whatever. You understand? So they are so smart. They want to ask you a basic dental question. So they'll just take a background of a scenario and they'll insert a basic dental question which is not related to the scenario. So here your dentistry comes into picture, not this scenario. Are you getting my point? Then the third option is 35% hydrogen peroxide. 10% carbamide peroxide. Now, this lady answered this question wrong. See, 10% carbamide peroxide is not a wrong option, but where it is used, 10% carbamide peroxide, it's used in home bleaching, correct? Not the in office bleaching. Now, again, they have mentioned 5% hydrogen peroxide as the last option. So, the only confusion that you should be having is between option C and E. Now, 5% hydrogen peroxide is too less. And if anybody has read dentistry even once, you would be having an idea about 30-35% hydrogen peroxide. So, that becomes the answer. So, you see, I'm sure you as a dentist would be practicing in your own clinic, and yet some of you might be confused with this question. You may be doing bleaching on a regular basis, I mean, whitening of the teeth. But you see how tricky the question gets? All the options are correct for a different kind of question. You understand? All the options. But the hierarchy goes where? 35% hydrogen peroxide. So, again, a detailed feedback is provided. I'm not reading it now because I've already explained it. When hydrogen peroxide is used as a bleaching agent, what should be the pH of the solution to be effective? Does this question has to do anything with this scenario based question? Nothing. It's a basic dental question. Understood? The answer is 10. Now this you need to mug up because this is a basic MCQ question. Yeah, you cannot have any options to choose. So yeah, the answer is 9 here, but this lady marked it as 10. So the answer is 9. This you read and you correct it and you mug up. So certain answers which are basic dentistry you need to learn. I mean, I can't teach you that. Now for this case, the dentist planning to do laminate after bleaching. What is the minimum time that he should wait after the bleaching procedure for proper shade selection? It has to be always 2 to 3 weeks to settle down. So immediately after bleaching is completed is a very wrong option. 1 week is too less. 2 to 3 weeks is correct. 3 months is again very less. Now 3 days. See, even if you did not know the answer to this question, immediately after bleaching is wrong. That your logic will tell you. You can get confused between 1 week and 3 days. But again, 1 week and 3 days are so close to each other. You will not go for that. You can be confused again now between 2 to 3 weeks and 3 months. 3 months is too long, man. Who will come back after that? So, by your logic also, even if you did not know the answer, you start eliminating the options. You would still land up on 2 to 3 weeks. Correct? Again, a feedback is provided. Now, we move on to the last question for today. Scenario based question 3. Alright. Are you guys with me? You are enjoying? Absolutely helpful. Yes, you explained very nicely. Thank you so much. That motivates me. Otherwise, I was like, maybe it's getting boring. No, but ADC study, actually is not boring. I honestly thoroughly enjoyed when I was studying it. Like me being a pediatric dentist, I kind of had lost a bit of touch on the general dental questions. Though I know I may not be practicing general dentistry because I'm an exclusive pediatric dentist out here. But I enjoyed it because, in BDS, what happens, you mug up for exams. Your goal, my goal in BDS was to pass the exam. A lot of theory I did not read, which was written so nicely by the authors, explaining such varieties of concepts because I knew they were not going to be asked in exam, so I waste time. Plus, there are so many subjects to study. I'm sure you people must also have gone through the same thing. But when I was studying for ADC is many of the exams that I've given. I've also cleared my MFD Ireland, so I have a diploma out there. Even when I was studying for that, I was enjoying the theory now because basic dentistry I knew. So the rest of the things that the authors had written very nicely about various concepts, I never got a chance to read it properly in my BDS level. And so when I was reading, so much of my mind was opening up to so much various concepts. And automatically when then I was seeing adult patients, sometimes, parents of the children that I see, doctor, can you also check my teeth? So I'm like, okay. I was so better able to diagnose it. I mean, I'm sure if you're reading ADC and if this is the only exam you're giving after your BDS and you've not done your MDS or any other Western exams, you will find it interesting. ADC exam is not boring at all. The study part also. Even if you buy something, God has different plans for you and you could not clear, trust me, the knowledge that you're going to gain by just studying this is going to be so useful to you in various areas of your clinical practice. There is no failure for studying for ADC exam. You will only gain your clinical knowledge. You clear the exam, excellent. You don't, still excellent, because you're still gaining such good knowledge. Okay. So I enjoyed, I really enjoyed studying for ADC part 1. I mean, I really thoroughly enjoyed. So I want to make this as an enjoyable experience for all of you also. Like the course that I had joined wasn't that interesting, and they were like kind of churning, just making us mug up things to pass. But I gave up on that course, because somewhere my heart was telling me this is not the right way to study, and I stuck to my study plan, and there I cleared. So I'm freshly giving you my study, and all the students enrolled with me currently, daily basis, some or the other keeps on WhatsApping me, and I keep on clearing off their concepts, and they're always like so thankful and grateful because they enjoy, So anyways, let's move on to the last question for today. A 23-year-old female presented at your clinic complaining of a lesion involving her back tooth. 23-year-old means what? She's a young person. Young means what? A lot of things can happen. However, it is not painful. Now, this is a very important thing. It's not painful, but it's a young person. Immediately, your mind, when you are seeing the picture, should go towards that hyperplastic pulpitis. The lesion has been there for a couple of months now, and she avoids eating on that side. The tooth responds abnormally to electrical and thermal stimuli and is not sensitive to percussion. Not sensitive to percussion meaning, again, what? The percussion test has been already done. Okay. Not sensitive means what? There is no PDL infection so far. So no periodontitis. Immediately you rule out the diagnosis as periodontitis. Tooth responds abnormally to electrical and thermal stimuli. They have not said it's non-vital. They said it's an abnormal response. Meaning, again, it's directing you towards a hyperplastic pulpitis. Okay. So this lesion is classified as necrosis. No, the question doesn't mention it. Reversible pulpitis. No, again, the pulp is exposed. It cannot be reversible pulpitis. Eruption cyst. No, because we see the tooth and it's destroyed. If you could not see the tooth and there would be a big bulb of mass over it, then probably you could have thought about eruption cyst. Periodontal abscess. What did I mention? No sensitivity on percussion. No radiograph available. No pimple. No pus oozing out. Nothing mentioned. So it cannot be periodontal abscess. So even by elimination of all the options, we'll land up on hyperplastic pulpitis. Though we know it is hyperplastic pulpitis, but in case you did not know, you can still eliminate it. Understood? This lesion most commonly affects patients who are. You see the answer? What did I say when I read 23-year-old young patient? So medically compromised? No, the question doesn't mention that. Suffering from HIV? Again, it becomes a medically compromised patient. You see, it's the same option but a different wording. Old and young, and all age groups. All age groups is not the right answer. When all age groups is not the right answer, automatically you have to eliminate young or old. And since our basic dentistry is there, we know the answer is young. So there. Most common cause of such a lesion is consequence of trauma. Trauma cannot lead to such a big cavity. It can lead to fracture of a tooth, but it cannot lead to such a big cavity. Diabetes, leukemia, hypertension, all medical conditions. This question automatically gives away the answer itself, low grade inflammation. Though it's by default, as a basic knowledge, you should know this, but even if you did not, again, by elimination of other options, you can reach to this option. See, I'm again repeating elimination of options because sometime in the exam, when you'll be exhausted, you will be confused as to which answer is right. That time, the elimination of option is going to be very, very helpful to you. And you should not also be overconfident. So, just because I knew the answer is low grade information, I should not skip reading the other options because sometimes the other option may be a little correct or may be the answer in the hierarchy that we chose, of the options. So, don't get very cocky or overconfident in the exam thinking, oh, I know this answer, I should not read the other options. You should read the other options. Chronic hyperplastic pulpitis is essentially what? Now, do you see this question? Chronic hyperplastic pulpitis is essentially what? This question has got nothing to do with this scenario. Even if this scenario was something different, I could have just asked this question as a basic dentistry question. So the scenarios sometimes are just a background, to lead you to 5 different kind of basic dentistry questions. So chronic hyperplastic pulpitis is, this is an Odell case, by the way. That's the importance of studying Odell. Don't go on those mentors who give you certain cases, like 5 or 10 or 15 cases to study from Odell, saying that these are the only important cases. No, boss, the entire Odell is important. Really, trust me. That's a mistake I made. I studied few cases, but before the exam, I was like, what the hell? Let me study. So I studied more other cases which were not told to me to study, and so many questions came from those cases which I just took up and started reading on my own. I wish I should have read the entire book. That was my mistake. That's why I keep on insisting to all my candidates, read Odell at least once, the entire one. Do not skip any case. So chronic hyperplastic pulpitis, pulp polyp is essentially necrotizing lesion. No, necrotizing lesion means what? It will cause pulp necrosis. Suppurative lesion, is there a pus discharge? No. Very sensitive, painful lesion. What did the question mention? No pain. None of the above is not an option. It could be, but I have the right option. Proliferation of inflamed pulp tissue, which is the correct option. If something else was mentioned here, then the answer would have been none of the above. But since they have mentioned the right option, I will go with that. Now, what is the best treatment for this patient? This patient, okay? Considering the overall tooth situation. Root canal treatment. Well, now here is a little controversy, okay? I have saved a lot of teeth having such a lesion with root canal. But the ADC and Odell and Cameron are of the view, when you have a young patient and such a destroyed tooth, you should extract it. So because these 3 authors are of the view that you should extract a destroyed tooth like this, you have to opt for the option of extraction, even though you may have saved such a tooth in your own clinic. Why? Because you're appearing for which exam? ADC. That's Australian Dental Exam. And if the Australian guidelines say so, you have to follow it because you're going to practice in Australia, not India or Egypt or any part of the world. Understood? So surgical removal of the polyp is not a right option. It's basically a hyperplastic pulp. There is no polyp as such. Extraction is the right option. A retrograde filling to seal the root. You cannot do a retrograde filling unless you remove the entire pulp, which is called as pulpectomy, which is called as RCT, so wrong option. Any of the above is not the right option because surgical removal of polyp is absolutely wrong option. So any of the above doesn't stand true. The only option that stands true is extraction. So yeah, 3 questions solved, almost 15 minutes done. I'll give you 5 minutes to ask you any doubts. And if you like this session, maybe I'll hold more of these sessions in future, discussing 3 questions, because you see, just discussing 3 questions is taking up such a long time. I hope you understood and are more clear now as to how you have to approach the exam. Understood? I give you 5 minutes, guys. Ask me any question if you have. Write it down. What about pulp polyp in older patients still extraction? See, pulp polyp usually will happen when there is a gross destruction of the tooth. Whenever there is gross destruction of the tooth, ADC people feel that it's a non-restorable tooth. So when it is a non-restorable tooth, then it is an extraction, even though the roots may be nice. So it doesn't matter the patient is old or young. Look at the picture of the tooth. If they have given extraction as an option, and if you feel looking at the picture of the tooth that a wide area is destroyed, then go for extraction. Where to study bleaching and endo related topics for ADC? Cameron, Walton, both these books are very nice. There are chapters, you can read them. For bleaching, you can also refer to your basic Grossman. Please hold similar sessions in future. Yeah, I'll try. I'll try my best. So what I'll do, you know what I've thought now, like what I was thinking, whichever mock test I roll out, like the sample ones where I post just 5 questions, because my main mock test have 70 questions each. And currently, anybody who's just wanting the mock test and doesn't want the materials, because most of you have the materials through one or the other people, but want to brush up on the mock test skills, I'm giving away 520 scenario based questions, like 8 mock test basically. So, but in my sample mock test, I just give away 5 scenario based questions. So, what I'll do is I'll start discussing 3 questions from each sample mock test that I am giving away. So, that's helpful, and you will keep on brushing your concepts. Infection Control is a very, very important book. It's not a thick book, guys. It's just like what, 50 pages or something, 50 or 100 pages. Yes, questions will definitely be asked on that, and in my mock test, I have included questions from it. In my own exam, I had at least 5 questions from infection control, and very important it was. Like, any tooth with gross destruction is indicated for extractions. Can we opt for post in our city? See, any tooth with gross destruction in a normal patient, see the picture, what is provided. But usually it would be extraction. If they mention cardiac condition, 100% extraction. Don't even think about it. If they mention bleeding tendency, hemophilia, then see again the picture of the tooth. If you think you can restore it, then you have to opt for post and RCT. So, depending on the medical condition, but mostly grossly destructed teeth go for extraction. So great, I'm happy with your feedbacks. So the next mock test I'll release probably end of this month. Again, 5 questions, but I would recommend all of you to, solve as many mock tests as possible. So yeah, there it goes. And probably this time I got a lot of responses for the last mock test that I posted, like around 89 to 100 people I think have solved so far in 2 days. It's nice, people are interested in solving. So the next mock test, I'm thinking of giving another surprise thing. I'll mention it on the group. So yeah, I hope this helped, and a very good night, and take care all of you guys. Almost an hour done in solving just 3 sub questions. But it was interesting, I enjoyed it also. Yeah, best of luck, guys. For any prophylaxis, surgical or for infective endo, if option mentions seek medical advice, is that the best answer? If they give refer, they'll say refer to a specialist. Yes, that is the best answer. Please do more sessions, man. This session was really helpful. Great. Good, good, good. It helped you all. So, yeah. All right then. Thank you, guys. Thank you all. See you next time.